Hi, my name is Grace, and today I'll be inserting a Foley catheter. The first thing I'm going to do is I'm going to verify the provider's orders, and I see right here that there's an order for Mrs. Charlene Knight to insert a Foley catheter as the patient is having urinary retention, unable to urinate. So I'm going to now go into my patient's room. Knock, knock, knock. Hi, Mrs. Knight. My name is Grace, and I'll be your nurse today. Can I please have your name and date of birth? Okay, Charlene Knight, 8/8/1939, thank you. And I see that you're allergic to penicillin, latex, and betadine, so I will make sure that that matches the order. I hear that you've been having some urinary retention, you haven't been able to urinate, so the provider has ordered a urinary catheter for you. And so I just want to go ahead and I want to assess the site and make sure that there's nothing that wouldn't allow us to insert the catheter. So I'm going to go ahead and I'm going to put the sheet down, and I'm going to put the side rail down, and then I'm going to go ahead and I'm going to perform hand hygiene, and I'm going to put on gloves. We may be dealing with discharge or lesions, so okay. And now I'm going to go ahead and I'm going to pull her gown up, and I'm going to just visualize the urethral meatus. I see that it is clean. I know that the nursing aide did perform perineal care this morning, so that looks good. And I'm going to note for any discolorations or discharge or abnormal lesions, but I don't see any. And now I'm going to go ahead and I'm going to palpate the bladder and check for tenderness or distension. It is a little distended, which makes sense since she's having urinary retention, but other than that, there's nothing that says we shouldn't put the catheter in. So Mrs. Knight, everything looks good for the procedure, so I'm going to go ahead and get that ready. And then take off my gloves and perform hand hygiene again. And now I'm going to come back to my order, and I'm going to verify that the catheter is correct. So I see right here 14 French Foley catheter, which does match the provider's orders. I'm going to go ahead and move that away. I see that there's nothing that she's allergic to in it, and I also see that the catheter is not expired. Next, I'm going to go ahead and make sure that the package is intact, which this one's not because I've used it previously for practice, but normally I would make sure that it's intact. Then I'm going to go ahead and I'm going to open that, and I'm going to take out my catheter. I'm then going to fold my plastic bag, which I will later be using as a trash bag. So I'm going to go ahead and I'm going to put that at the edge of the patient's bed. And now, Mrs. Knight, I'm going to go ahead and I'm going to put you in the correct position. So I'm going to go ahead. At this time, I'm also going to raise the bed higher so that I am working at my waist level, or above my waist level, and yeah, okay, so now Mrs. Knight is in the correct position. I'm going to go ahead and I'm going to perform hand hygiene again, because I will now be working with a sterile field, and I want everything in my view, and I want everything above waist level. So I'm going to go ahead and I'm going to open the flaps, beginning with the top uppermost flap, and I'm going to go ahead and grab the 1-inch margin of that flap, and I'm going to pull it open, making sure not to reach across my sterile field. I'm now going to grab the left flap within the 1-inch margin and pull it over, followed by the right flap, and lastly the bottom flap. And reaching within only the 1-inch border, I'm going to go ahead and I'm just going to kind of readjust that so nothing's hanging over too far. I'm now going to grab my blue drape, and the corner is folded with the shiny side up. I'm going to go ahead and only touch that part within the 1-inch margin. I'm going to step back, and with the shiny side down, I'm going to go ahead and drape that under my patient. I'm now going to go ahead and I'm going to grab my gloves and I'm going to place them at the edge of my table, and I'm going to make sure the whole time that my sterile field is staying in my field. So I'm going to go ahead and I'm going to open these gloves. And I'm going to just kind of fold it back to make sure it doesn't fold up on me. And as you can see, there's cuffs. So I'm going to go ahead and with my non-dominant hand, I'm going to grab the inside cuff of this glove. I'm going to step back away from my sterile field, kind of reposition that, again, only touching the inside of the glove. And then above waist level, I'm going to supinate my hand into the glove. Next, I'm going to take the 4 fingers of this hand and I'm going to reach into this one. I'm going to step back and again, above waist level, supinate my hand in. I'm now going to get rid of this and I'm going to go back to my box where I see the white drape. I'm going to go ahead and grab the corner of that, step back, and I'm going to reposition that. And I'm going to go ahead and drape that over my patient. I'm now going to come back and I'm going to reposition my box, sterile, can touch sterile, and I'm going to go ahead and grab the hydrogen peroxide. And I'm going to put that over my cotton balls and throw that away. I'm then going to grab my lube and I'm going to put that in the corner of my box. And then I'm going to go ahead and I'm going to move the top over. I'm now going to grab my syringe, which I see has 10 milliliters of sterile water. I'm going to look for the green cap on the catheter, and I see that it can hold 5 to 10 milliliters of sterile water. So that matches up. I'm going to go ahead and I'm going to hook that on there, and then I'm going to go ahead and place that back in my box. Okay, next I'm going to take my catheter with 2 hands and I'm going to go ahead. My syringe just fell out, but luckily it was back onto the sterile field, so everything remains sterile. With 2 hands, I'm going to go ahead and take the sheath off of my catheter, and I'm going to go ahead and place the tip of that in the lube, and then I'm going to place that back into my box. I'm now going to put the lid back on the box, and I'm going to transfer my box back over to my patient. I'm going to gently drop the box, and I'm done with this. My sterile field is now completely over here. I'm going to go ahead and grab my forceps, and I'm going to purposely contaminate my non-dominant hand to hold open the labia. I'm now going to take my cotton balls and I'm going to clean the vagina. So first I'm going to go from clitoris to anus, and I'm going to do labia majora, go around my sterile field and throw it into the trash bag. Labia minora, around my sterile field, throw into the trash, and then down the middle, around my sterile field, throw into the trash. And now the other side, labia majora, around my sterile field, throw into the trash. Labia minora, around my sterile field, throw into the trash. And lastly, the middle one more time. Around my sterile field, throw into the trash. I can now throw my forceps in the trash. I'm done with that. And I'm gonna go ahead and I'm just gonna move this. Okay, I'm just gonna move this over here. Now I'm gonna go ahead and I'm gonna grab my catheter 2 to 4 inches back so that my fingers aren't going to touch the urethra meatus. And I'm gonna tell Mrs. Knight, you are going to feel a little bit of pressure, so if you could just bear down for me. And now I'm gonna go ahead and without touching anything else, I'm going to insert the catheter and I shouldn't feel any resistance. I want to make sure that my fingers aren't touching. And, as soon as I see urine, which I just did, I'm going to go ahead and I'm going to insert it 1 more inch. And then I'm going to go ahead and I'm going to hold it. And I'm going to go ahead and inflate my balloon. And then I'm going to bring it out. And I'm going to unhook it. And now I'm going to grab my bag and I would secure to Mrs. Knight's inner thigh at the bifurcation. And then I would secure the bag to the bed, but not the rail because that does move. And I would tell Mrs. Knight, how did you tolerate the procedure? And I would go ahead and tell her that I would be coming back every shift to perform catheter care. I would then document accordingly, noting the type and size of catheter as well as the input and output, the characteristics of the urine, and how Mrs. Knight tolerated the procedure. I would then take off my gloves, perform hand hygiene, and I'm done.